Okay. طيب. We can discuss and we can do it as an interactive session. طيب بسم الله الرحمن الرحيم والصلاة والسلام على خير الأنام سيدنا محمد وعلى آله وصحبه وسلم. Welcome in new lecture of the therapeutic. We discuss today how to prevent the recurrence and how to prevent the progression of coronary artery disease. In last lecture, we speak about the coronary artery disease. وقلنا هي included stable ischemic heart disease اللي هو stable angina variant angina. When we speak also about the second type اللي هما more progressive اللي هو بنسميه acute coronary syndrome. So today we'll speak about the simple one, which is ischemic heart disease and how we can use a drug to prevent the recurrence and to prevent the progression. طبعا we speak about the approach how to treat the patient with stable ischemic heart disease. The details with Dr. Faisal ونحن اتكلمنا عن الابروتش in general. Now we will speak about the adjuvant therapy اللي هي اللي بتمنع progression and prevent the recurrence. We have three main drugs اللي هو the first one هو antiplatelets, the second one is AC inhibitors, the third one is statins. This is the most commonly used drug for prevention of progression. We start by the first one which is antiplatelet. والantiplatelet أكتر واحد مشهور فيها هو الأسبرين, cheapest and effective one. وزي ما عارفين كلنا الأسبرين used with the low dose which is block COX enzyme بيقفل لنا COX enzyme 1 and 2. طبعا احنا بهمنا 1 here which is decrease the production of thromboxane A2 which is very important for the platelet وبالتالي it will stop the function of the platelet. وطبعا زي ما عارفين انه it is block the enzyme irreversible. So this platelet cannot do its function again unless there is a new platelet. وبالتالي if the patient has surgery, elective surgery أو كده, we have to stop the drug for 10 days at least عشان the patient have a new platelet which is working well during surgery and after surgery. We use the drugs with a low dose. Effective dose اللي هي less than 100 is a if we are increase the dose it will not give additional benefit. وبالتالي كل ما نزيد الدوز it will give other effect لكن it will not give more effect as antiplatelet effect. وبالتالي we need to use a low dose. برضو اللو دوز عندها additional benefit effect إنها طبعا الأسبرين is stop the COX-1 which is stop the thromboxane A2 وبرضو stop the production of prostacyclin. البروستاcyclin is a good for the prevention or for vasodilation لكن unfortunately the drug will stop the prostacyclin. When we use a drug with a low dose so prostacyclin will stop partially وبالتالي بيكون في high amount of prostacyclin وبالتالي بتديني vasodilator effect better. يبقى the most effective the most recommended dose is a low dose of aspirin and no additional benefit from increase the dose. It's recommended by ACC and AHA and it decreases the progression of the disease to myocardial infarction in stable ischemic heart disease up to 87%. وبالتالي is very effective and very important for a patient with stable angina or stable ischemic heart disease. طيب the problems with aspirin in some patients اللي هم 6% about 6% of patients there is a non-responsiveness for aspirin. ال 6% ده بنسميهم a true non-responsiveness. يبقى البيشنت actually has no response for aspirin. Sometimes this is associated with using of other drugs. زي ما عارفين الأسبرين is bind to the COX enzyme. وبالتالي any other drug which is bind to this COX enzyme, it will decrease the binding of the aspirin to COX enzyme, which can lead to decrease the efficacy of aspirin لأنه ما هيقدر أصلا يرتبط بالكوكس enzyme, so it decreases its function. طبعا الدراجز which is bind to COX enzyme other than aspirin is a drugs which is known as non-steroidal anti-inflammatory drugs زي الأيبوبروفين. البيشنت اللي بيحصل لهم نون ريسبونسيفنس طبعا بيزيد عندهم the risk of the ischemic events and progression of the disease. And if the patient develop a true non-responsiveness, the increase of dose also is not effective. وبالتالي if the patient develops this non-responsiveness, we have to use other drugs than aspirin to give the same effect as antiplatelet. The main alternative for us for this patient is a drug known as a clopidogrel. Clopidogrel is antiplatelet block receptors اسمها ADP receptor adenosine diphosphate receptor, which is important for برضه platelet aggregation, so it can be as alternative for aspirin. دايما بنستخدمها if the patient is allergic أو intolerant patient حصل له منه side effect ولا كده. لكن it's not a first choice for the patient. This is just a comparison between clopidogrel and aspirin. Aspirin is a first line and it is the cheapest. Clopidogrel higher cost, and the aspirin remain the first line for treatment. طيب, could we use in stable angina a dual therapy? That means we use dual antiplatelet therapy, يعني نستخدم aspirin with clopidogrel. Is not recommended in stable angina to use a dual therapy, and it has no a higher benefits. Slightly, it can cause a higher benefits in severe cases وكده. Like it's not recommended to use a dual therapy. We just use aspirin, or if there is a problem with aspirin or side effects, so we can use clopidogrel. It could be used as a dual therapy and highly beneficial if it is more progressive than stable angina. يعني البيشنت لو حصل له acute coronary syndrome حصل له myocardial infarction أو عملنا له PCI percutaneous coronary intervention وكده, we can use a dual therapy, and in these cases they are very effective and recommended. لكن هنا is not recommended. The adverse effect of the drugs is GI upset. Almost هم مروا علينا كلهم. The GI upset, mainly it can cause irritation for mucosa of the stomach, وبالتالي ممكن تعمل للبيشنت gastric ulcer, irritation, dyspepsia, even bleeding and perforation. Increase the bleeding risk طبعا لأن platelet بتبقى non-functional platelet, لكن طبعا ما بزيد ال PT and PTT in investigation, just the platelet is not functioning. And it can cause a tinnitus with a high dose اللي هو ممكن تعمل زنة في الأذن وكده. And دايما عارفين with a chronic dose, when we use the drugs for years with a high dose, it can cause also a renal problem, بتعمل interstitial nephritis, وبالتالي البيشنت can develop a renal failure. Salicylate poisoning is common, especially in children who are taking the whole bottles of her mother or father, so develop the salicylate poisoning, and it can cause allergic reaction in some patients or in the home cross reaction. If aspirin develop يعني hypersensitivity reaction or allergic reaction, if we use other non-steroidal anti-inflammatory drugs, it can cause the same reaction or hypersensitivity. The last one is the Reye syndrome or Reye syndrome, which is a hepatic encephalopathy associated with use of aspirin after a viral infection and fever in children. So the drug is not recommended عادة in children to be used because this case is fatal. تمام? If there is no question, we will continue and we going to ACE inhibitors and ARBs. And in ACE inhibitors and ARBs, we recommend to use if there is a stable ischemic heart disease with other concomitant disease like يعني بنستخدم ال ACE inhibitors when there is a stable angina with a hypertension, diabetes, or a heart failure with reduced ejection fraction يكون less than 40, or chronic kidney disease. This will prevent the progression and could be beneficial in other disease اللي هو concomitant disease which is associated with angina. The preferred one is ACE inhibitors. The alternative could be ARBs. The last one is statins. And in statins زي ما عارفين الإستاتينز is anti-hyperlipidemic drugs which is affecting the HMH-CoA reductase enzyme, which is important for production of the lipids. So as a result, it can decrease mainly the LDL of the patient. So commonly we give this drug as a first line for most of the patient, لكن هو highly effective in LDL mainly. It can also decrease the triglyceride and VLDL, لكن less than the LDL, and also it can increase slightly the HDL. The most common adverse effect for the patient عادة بيكون في gastric upset و headache after using the drugs, especially in first days. The most serious adverse effect is the hepatotoxicity, which is commonly from the old drugs اللي هم زي اللوفاستاتين. ده زمان كانوا بيعملوا hepatotoxicity. The new drugs is less likely to cause and myopathy. The myopathy patient may start by the pain of the muscle, and it could be progress up to cause rhabdomyolysis, as you know. Like, it's very important to use a statin in patient who has a high risk for the myocardial infarction and ischemic heart disease. It is recommended and significantly reduce the risk of mortality for the patient. So most likely patient بيكون عندهم high risk for the MI and acute coronary syndrome. We use statin with lifestyle change. This is a last stable last table which is give us the risk factors and how we can modify the risk factors to decrease the stable ischemic heart disease. You can read all of them and to know the main feature. The very important point we have to know that when the patient has ischemic heart disease, stable angina or acute myocardial infarction, and diabetes, our target should be about 7 to 9 if the patient has other disease, and below 7 in hemoglobin 1C. And the most important is don't use or avoid the use of rosiglitazone because it will aggravate the cardiac cases. The last slide is a summary. When we have a patient with stable angina or stable ischemic heart disease, our option will be anti-anginal therapy, and the first line is the beta blockers, and the second line is calcium channel blockers and nitrate if there is a problem with beta blockers, and the third line is ranulazine. Then for all patients, we are preferred to use these drugs to prevent the recurrence antiplatelet, mainly the aspirin, and as alternative, the clopidogrel and ACE inhibitors for the patient who has a concomitant disease, diabetes, hypertension, chronic kidney disease, or heart failure with reduced ejection fraction, and statins. all the patient should treat the comorbidities, which is could be managed. And that is all for the first lecture. Any question?
دكتور
Yes.
دكتور معليش لما تكلمت عن البروبلم with aspirin بالبداية يعني أول شيء قطع صوتك فعادي تعيدها.
في تو سلايد بالضبط كده عشان أعيدها.
ما أتذكر
يعني
دكتور بس
أول
هي
سلايد.
البداية أتوقع أيوة أول ما قلت the problem with aspirin تقطع الصوت.
طيب تاني إذا قطع الصوت في أي وقت بليز يعني نبهوني عشان نحل المشكلة وبعدين نمشي. طيب we discuss aspirin first slide again. زي ما قلنا aspirin is very important for a patient with coronary artery disease سواء كان عندهم stable angina or the patient with acute coronary syndrome اللي هي more progressive. We use aspirin. قلنا الميكانيزم of action of aspirin هي معروفة إنه it decreases thromboxane A2 which is very important for aggregation and function of the platelet. It has about 4 functions for the platelet function. So when we stop this thromboxane A2 or decrease its production, we will stop the function of the platelet. It gives irreversible effect. So this platelet after affected by aspirin cannot do its function again. So if the patient has a surgery, for example, and he is using aspirin for a long time, so we have to stop the aspirin till a new platelet is coming, which is need about 7 days. So we take about 10 days, then we do the surgery or elective surgery. The aspirin antiplatelet effect is a low dose aspirin. بمعنى we have to use a low dose aspirin to give the high benefits as antiplatelet and decrease the risk factor. If we increase those, it will not give additional benefits as antiplatelet. It will give other effect, like it will not give benefits as antiplatelet. And we use a low dose aspirin for all patients اللي هو about 100 milligram or less 75 80 كده. And we can use alternate day. أحيانا بنستخدم 3 to 5 milligram اللي هو 325 لكن alternative day. day yes and day no. المهم تكون low dose. طبعا الاسبرين also will stop the production of the prostacyclin. And prostacyclin is good for the patient with ischemic heart disease. It can cause a vasodilation. Unfortunately, the aspirin can stop the production of this prostacyclin. Lakin when we use a low dose of aspirin, it will give additional benefits that the production of prostacyclin will be as minimal as possible وبالتالي there is a prostacyclin which is help in vasodilation for this patient. It's recommended aspirin to be used by the ACC and AHA for all patients with stable ischemic heart disease, and it prevents the progression to myocardial infarction in 87% of the patients. So it is highly recommended to use in all patients. تمام؟
إيه دكتور شكرا يعطيك العافية.
You're welcome. And احنا to differentiate between two lectures, we will close this one and we are enter again by the same link to continue in next lecture. يلا إن شاء الله نكفي ده ونبدأ بالجديد إن شاء الله. طيب.